Hi, this is Dr. Johnny Brennan again, doing another tutorial with some tips and tricks for easier workflows in axiUm Ascend. So this time I just wanted to talk through some of the clinical movements that you might make and help point out a few nuances to the user interface that might help you better understand things or more quickly get to what you're looking for. So a couple things I wanted to point out. We're in a test patient here that we've selected. Sometimes by default or because somebody's clicked it, you can hide this patient information bar here. So the reason I would point out that you might want to actually show that window is we've added some shortcuts here that make it so you don't have to do multiple clicks into a menu and then find what you're looking for to get to certain sections. So these are some of the most common, especially from a clinical standpoint. So whether I'm out in the schedule or in a different area, I can jump very quickly into the imaging section or back again to the chart. And you can notice I'm just able to navigate a lot faster using those shortcuts. Now that I'm in the chart, a few things I want to point out. Number one, you've obviously noted tooth numbers throughout, but in this case, there are black circles around the tooth numbers. Those black circles, when they're fully filled in and really dark, those indicate that that tooth has at least one image associated with it. So if I select that tooth, you see an image peek option up here, and when I click image peek, it opens up the image without having to fully load all of the images associated with this patient. Then if there's more images, in this case it brought up the pano for that patient. If there's more images specific to that tooth, I can click the next arrow and it should, if it loads up, it should load up the images for that specific tooth. In this case, it's pulling up panos for our image for the tooth number I selected. The other thing I want to point out is you'll notice in this case, they're all this nice dark black. Over time, as the images age, that lightens up, so it becomes a gray and ultimately becomes just a circle with no background, a white background, indicating that it's likely time to consider retaking an image for that tooth. It's been quite a while. So that can help you at a glance at the chart see if there are teeth in here that may be due for images very quickly. So you can use image peek to quickly get to viewing images for that tooth. The other thing I wanted to point out specific to the chart is when you select teeth, this can operate as a selector through other parts of the clinic workflow. So the most important that I use regularly is by selecting tooth number 2 or any of the teeth here. When I jump over to the progress notes, it's now filtered my progress notes to that tooth that I had selected and given that as an option of the filters on the left. So to give you an idea, just to show if I hadn't selected, I've got this laundry list of procedures or things that took place or are treatment planned, etc. But in this case, by coming back through and in the chart selecting tooth number 2 and coming to progress notes, now I'm seeing the note associated with tooth number 2 as well as the treatment plan procedure. So I've filtered by just that tooth. So just a couple things to consider when you're using the different selectors in the chart and how you might improve your workflow or speed by using the tooth selector.